Menopause and perimenopause is such a complicated time in life where there are multiple changes to multiple organ systems going on. Women will complain about a variety of different organ validated symptoms like heart palpitations, frozen shoulder and joint pain, hot flashes, night sweats, mood changes, changes to libido, vaginal dryness, bladder and urinary health, among many, many others. It would be totally naive of anyone to think that they could treat all of the different symptoms of menopause with a one-size-fits-all approach. Menopause should be approached in an individualized way where we understand everything there is to know about you as a patient. What are your symptoms? Which of the symptoms are bothering you the most? What's in your medical background that would dictate one approach to treatment over another? What insurance do you have? What are you hoping to achieve out of your hormone therapy? Is there more to your treatment approach than only prescribing hormone therapy, like weight management or mood management or sleep management or libido management? And when it comes to hormone therapy, what is the hormone therapy approach that is going to be most appropriate for you? There are many different ways to prescribe hormone therapies. There are oral options, there are options through the skin, there are combination products, and there are products that we prescribe together in different doses. These products are all prescribed on an individualized approach because not everybody has the same symptoms and not everybody has the same needs when it comes to treating them. It takes a really in-depth understanding of the benefits and risks of all the different treatments to be able to understand what is it that you as an individual patient need to best be treated in a safe way and in a way that is effective. At the end of the day, it's important that the treatment you're offered is individualized to your needs, to your symptoms, and is going to arm you with the option to be successful in the future at being compliant with your medication and having your symptoms treated in a way that minimizes side effects and maximizes efficacy. My over a decade of experience and my experience treating women with a variety of different medical conditions and being involved with large-scale research projects and working with different drugs over the years has really allowed me to understand how an individualized approach can be utilized to impact patients' success and symptom optimization. My approach and the approach that we use at Coven under my guidance is to listen to a patient and understand what symptoms are bothering her the most. We also want to understand about your medical history, the family history, the surgeries that you've had, the risks and the benefits, and what you're hoping to get out of your menopause management and what symptoms you're trying to improve upon. Some practitioners out there don't have that really in-depth understanding of different hormonal therapies to know how one treatment is going to impact something like your triglycerides or your cholesterol versus how it's going to impact your bone and what doses are needed to get bone protection with different hormone therapies. One of the benefits of my multitude of experience is really understanding how each and every hormone therapy is going to impact that. Are you someone who's high risk for breast cancer? There are certain hormone therapies we can prescribe that actually lower the risk of breast cancer or treat breast cancer in small studies compared to other hormone therapies. Are you someone who's at risk for a blood clot or who's had a blood clot in the past? There's going to be a variety of hormone therapies that are off the table when it comes to risk, but we can be quite creative with other hormone therapies that may not increase your risk. So if you've ever been told you're not a candidate for hormones or told that you are, but you've got second questions about it, it's really important that you be seen by somebody who has a very deep understanding of all the literature that's out there and how hormones and non-hormonal therapies can be utilized to really optimize your symptoms and your risk. One of the most exciting things that has happened in menopause options recently is the advent of a new class of medications that are very powerful at treating hot flashes and night sweats, but are not hormonal in nature. These medications are called neurokinin antagonists, and they work at the same place in your brain that estrogen works to mitigate hot flashes and night sweats, without the risks and benefits of using estrogen therapy. If you're someone who's suffering from significant hot flashes and night sweats, but is hesitant or unable to take hormone therapy, There is a whole new world opened up that can really give effective treatment and symptom management without exposing you to the risks and benefits of using hormone therapy. I think the pendulum has really swung when it comes to menopause management, where many people are interested in hormones now, but we also have to think about the women who would benefit from non-hormonal therapy or who could potentially be harmed by taking hormone therapy. And by having this new class of medications, there are two approved in Canada as recently as this week, fezolinetant and elinzanetant, were able to offer significant, powerful symptom relief without exposing you to the risk of using estrogen if estrogen is dangerous because of your medical history. Something that I've seen be really popular from certain clinics and also out there on Facebook is the recommendation that just throwing progesterone at somebody in perimenopause is going to solve all of their symptoms and problems. It's really important that we give balanced, evidence-based recommendations around hormone therapy. There's no doubt that some women do really well when giving specific doses of progesterone, and it's also very reasonable to help and guide women through their different progesterone doses to find the one that is going to work best for them. There are also women who really do poorly when it comes to progesterone, specifically women who've struggled with PMS symptoms for most of their lives. And we don't want to, again, give a one-size-fits-all approach where progesterone is the answer to all problems perimenopause. Instead, what I like to do is listen to my patient and find out what symptoms are bothering her the most, what time of her cycle are those symptoms bothering her the most, and what's going to make the impact that is going to give her the best symptom relief and quality of life going forward. Sometimes this involves a combination of progesterone and estrogen. Sometimes the estrogen should be given daily, and sometimes it should only be given at certain times in the menstrual cycle. But what I've come to understand over many, many years of experience is there isn't a single approach to perimenopause and menopause that is going to help a woman feel better. And certainly we don't have enough evidence to say that some of the approaches like progesterone every single day at any time in your life is safe. At the end of the day, it is our job as physicians and nurse practitioners to do no harm. And it is really important to me that all the care we give is individualized and evidence-based.